Hello and welcome to EduAdvisor's webinar series where we speak to industry experts, professionals, and academicians of various backgrounds to give you key insights about their professions. I'm Nina and I'll be your host for this session about medicine studies. Thanks for tuning in. Today we have Dr. Imam Sheikh who is here to share with us on the pathways to becoming a doctor. So before that, a little background check on our speaker today. Dr. Imam Sheikh is a senior lecturer in pathology at the School of Medicine, Taylor's University. He obtained his MBBS and MD in pathology from Rajiv Gandhi University in Bangalore, India, and also has a postgraduate qualification in medical education from Newcastle University, UK. His expertise is in several fields of pathology with a special interest in infertility, investigative medicine, and hematology. He is also a passionate teacher with 13 years of experience in medical education and is currently in the field of medical education, having a primary interest in teaching and assessment methodologies. Before we continue, if you have any questions for Dr. Imam, do leave a message at the comment section and we'll get to it at the end of the session. So let's just dive in, Dr. Imam.
Yeah.
So to start, why did you choose to become a doctor and what inspired this career choice? And have you always wanted to be in the medical field?
Yeah. By the way, hello everyone. It's nice to be here talking about my passion, my profession. Yes, as I mentioned, it's my passion, but I do remember since childhood I was inspired by many doctors, in my life. Every time I come across, I used to see the passion, the enthusiasm. There are many examples I quote, but I remember one of the very personal thing. At a very early age, around 10, I was sick, and in fact, seriously, I was undergoing a surgery, and the pediatric surgeon who was dealing with me, a small child, remember what he did, how he was passionate, how he was dealing with a child, and how concerned he was. After my surgery, we were waiting for what was the result, what was that we were dealing with, and I saw more concern with him than my parents. And when the results came in favor, it was nothing big. He was joyful, and that time I understand how much he has that empathy. Rather than empathy, I tell you, it was like I was not knowing what is the results or what's the impact of that, but he was more concerned. So this, I think, really inspired me very early in my life, and coming in my life future, later half, many doctors come across, and I was lucky, in fact, to be a doctor, because I was, as I mentioned, I used to be very sick, but I used to think how to best I can, because I can, this to the future students who are thinking, who don't have big grades, can they become a doctor? I think, yes, you need passion, you need serious attitude towards that, then I think you can come.
Right, so you would say that your interest in medicine was started because you were inspired by this doctor's work.
Yeah,
so
definitely.
You already had it since you were young.
Yeah.
That's really amazing, actually.
True.
So I understand that your expertise is in the field of pathology. So what made you decide to choose this field? And perhaps for those who are not familiar with this particular field, could you tell what pathology is about?
Yeah, very interesting. I think very few general public are exposed to pathology. Pathology, if you ask me, very simple definitive term, what is the definition of that is it's a study of your body in disease state. When the body get a disease, what happens to body, what happens to your organs, what happens to your tissue, what happens to your cell, that is reflected as a layman signs and symptoms. The patient comes to doctor when he got problem with particular presentations, but what is happening inside the body and how has happened. For example, you have an infection which has entered your lung and causing pneumonia, and that how is happening that. So all this study of the disease process is pathology.
Right.
Basically, pathology is a fundamental science in medicine, very basic and important platform. It not only helps in understanding the disease process or making understanding the diagnosis of the disease, but also it's form an important platform from which the management is decided.
Right.
I mean to tell, investigations and treatment is based on what is the disease inside and how it has happened. So it's a very important bridging discipline in medicine. Definitely many people don't see pathologists directly. We are behind the screen people working in hospital setup. Yeah, we are in the labs. What people can remember when they are go to doctor and they will be asked to go for tests, blood test, urine test, and some body fluid test, and they send it to lab. And pathologist is the person who will be doing these tests. And more serious, like nowadays we are more concerned with cancers, and people undergo surgeries or investigations for cancers. Just take out some tissue and tell whether there's a tumor or not. They are the one, pathologists are the one who will do the making the diagnosis. In fact, I remember pathologists, if you know who are the pathologists, early, what inspired me to be in the pathology, early in my MBBF, one of my teacher told me, pathologists are doctor's doctor. Doctor's doctor, because if patient don't know what he's going through disease process, he go to a doctor. And if a doctor don't understand what is the disease process, he will send to a pathologist. So it's really, when I joined pathology, I remember everyone want my number. They want to keep doctors, specialists. Oh, you are pathologist. Oh, really? Can I have your number? That's just to keep me in touch. So that's really amazing when I joined pathology. But it's challenging also, because we are on the hot seat. Just one statement of you can change the whole course of the management of the patient, especially when you're dealing with serious disease, for example, tuberculosis or cancers. So it's a challenging, but fun at the same time, because you are being at center of something, making big decisions and making big change in patient's outcome.
So would you say with this current climate of the COVID-19, pathologists are responsible with finding the underlying causes of this particular disease?
As a team of doctors, yes, there are many people who work for these things. If you ask me about, nowadays we have become more specialized. In pathology, we have many disciplines which are sub-specialized. The microbiology, in that virology, and further in pathology, where hematology, other things. So I think the discipline which deals with the virus in COVID-19 are the virologists. And they are the one who are at present studying, trying to understand the nature of the disease. Yes, we are working all over the world, different scientists, on getting as soon as possible the vaccine for it, treatment for it. And it's a big challenge. It takes time, it takes at least 8 months to a year. So hoping for everyone to get it so near to that.
So doctors are trying their best to find treatments for all the diseases that's happening.
True.
So talking about being a specialist, how long does it take for a student to be one, and can you give us an overview of the education journey for one person to be a specialist?
Okay, to start with, to enter medicine, what is the requirement? Many students who are doing SPM, STPM, they should be knowing that the minimum requirement to enter the medicine starts at the level of either A level or foundation or STPM. We talk like in our Taylor's university, if you want to join School of Medicine, the minimum entry requirement is at least, for example, A level you're talking about. It's at least 3 Bs with subjects of biology, chemistry, physics and mathematics. Biology must be needed. And if you're looking into entering this, okay, you have to start with this. Then you come into medicine. Medicine is a 5-year course, and then you need to do internship another 2 years, and then you have to be in Malaysia, because if you want to go for masters, you have to work as a medical officer for another at least 2 years, and then start showing your interest, that which specialization you're going to go for. Either you go through this way. Another option of becoming specialist in Malaysia we have is of the UK. You can go for doing, you heard of MRCPs, Member of Royal College of Physicians or Gynecologists. You can go that line, writing an exam for that, and then entering the specialization. So we have 2 ways to do in Malaysia to become a specialist. Altogether, if you tell me, it's almost like 10 plus years to become a specialist. Yeah,
that's a long time.
It looks long, but very interestingly, to note down, it's just the first 5 year of MBBS which you are a student. As soon as you join internship or housemanship, you're already in the profession. You are getting salary. You are working. You don't become a specialist like other profession. For example, in the business, you do MBA 3 years, you write an exam, you're specialist of something. Medicine is not. It's more important is experience.
Right.
How experienced you are. That's why in Malaysia, after housemanship also, they expect you to work in that field as an MO with the government sector to show your passion. Really, you want to be this, because medicine is a subject where a lot of dedication, patience, and passion is needed. And because you're dealing with humans, okay, you cannot step back. That's why I think that will take some time, but it's like it's ongoing job, all joint training. You can tell it's not a study course.
Yeah. All right. So you did mention that for a student who want to pursue a specialization, it happens after they become an MO. That's when they find their passion within the industry, in the field.
In fact, that is different. In our Taylor's University, when a student joins as an MBBS, we encourage. In fact, from the day one when they come for interview, we ask them what you want to be in future. Not only to focus, to start thinking on that, but in the course itself, we have different places where they can take it. For example, we do assignments and projects. We encourage them to do something which you love to do, to see whether you are interested or not. And another is like we have a research block dedicated 5 weeks in year 2, a research block. Student choose a topic to do a research under the guidance with a guide, and then after 5 weeks it come out with a outcome. It's like they publish some. Many good number of students publish articles in year 2. So with this, in clinical years, when they go to hospital, year 4, we have a dedicated 8 weeks posting. A student, we call elective posting. Student can go any place, not in the hospital, which we are teaching, anywhere in the world with a subject of their interest, which they want to be specialist in future, and do the training with the best people they know, and think whether this is for you or not.
Right.
I remember many of my students, who go and they find, oh doctor, this is what I want to do. And sometimes some student come back, doctor, especially I remember one of my students who want to become a gynecologist. There was boy, he gone to India, then say 8 weeks when he come back, doctor, that's not what I want to do. And it's really good, it's not after you join the thing, it's beforehand you get an experience, including the internship. When they go housemanship, they will be going through different postings. So becoming specialist, because today's world is very competitive, you cannot take something which later you tell I'm not for this. Including medicine, they come out with very clear visions. I find that is very becoming common. Dropout rates very few.
Okay, all right, thank you for that. Let's talk a bit more about the first steps of becoming a doctor, which is medical school, of course. So what is medical school like? I think we have a lot of students who are wondering, what is it really like? And perhaps you can walk
with us through what students will go through during their academic phase and also the clinical phase.
Yeah, being a medical student, if you ask me how was the medical school, it was like fun. Okay, I missed that. It's a 5-year course, hardly any other professions which is so long, and you study, you get knowledge, you develop, you make good friends, and I really appreciate the medical life is what last time people used to tell, student life is a golden life. Yes, I have seen that golden life in the medical school, truly. Okay, if you ask me how the life in medicine, you see, because from outside it looks tough. From outside, student looks stressed, but not necessarily that means if they are stressed, they are not happy. They are two different things. Okay, and that's what I really, sometimes people may take wrongly. The first, if you ask me, okay, how the program early years, for example, the student join in our Taylor schools, we have 5-year course. Preclinical 2 years, which we conduct in our Lakeside campus in Subangja, and 3 years clinical side. We have a Taylor's clinical school dedicated in near the Sungei hospital, because our students go to Sungei hospital. So 3 years they stay in that campus, very near to hospital. So the first half is campus based, where they study basic science subjects like anatomy, physiology, biochemistry. We have very integrated interactive programs with a lot of interactive teachings. We have our universities do promote for like online learnings and e-learnings, X spaces, interactive. So those things are I agree. You know, usually the students tell, "Oh, medicine is really hard. Looks like very hard." Uh, I can tell hard. The term hard itself is a relative term. It's how you take it.
Right.
So, what my opinion in terms, I have seen many students initially they think that way, but more important, what passion you are coming with. See, if you have a passion, if you have a motivation, then everything looks good for you. Let it be hard, but at the end of the day, I always give examples to my students of a football player.
Right, okay.
A player who's play football, he, if you ask me any time of the day, let it be sunny, rainy day, let's play football, what he will tell, let's go.
Yeah.
The whole day he will play, he's tired, sweaty, smelly, bloody, means he will bleed also. At the end of the day, if you ask him, how was the day?
Right.
What he will tell? It was
Yeah, it's a
fun.
good day, yeah.
So that's what the medical student should prepare their mind. If you want really to be a doctor, come with the passion. And this is a place to have amazing things to see around. You will be enjoying. In the sense, at the same time, student life, if you ask, in our Taylor's University, we do know these issues, and that's why we create a proper environment for them. If you come across our university, that's why in the Lakeside campus, we not only have School of Medicine, we have more than 40 different programs, students, and we have a lot of clubs. We encourage our students to do extracurricular activities, let it be in the sports, let it be in the music, let it be any social activities. We promote them. We have a program called Shine. In that they do a lot of social activities. We have also our program which support the student in not only motivation point of view. We call a concept called a module which is 2 credit. We call it as social innovation projects.
Okay.
Where medical students with the other disciplines, let it be from engineering, design school, computer schools, come together, do a social project, go to the society and see what the problem they have, together how they can solve.
Right.
They can see there how being from a medical background help in the society. They see the value of their knowledge, value of the profession, right starting point.
Right.
So that that can motivate them to study medicine.
Right.
Motivation is very important, and definitely we do have at the same time student support system, counselors,
Right.
so that we support them anytime they feel they're lost, they feel that they are not doing good, how they can do better. We have learning support system, we have psychological support system. So I think we have in fact life skills module is a separate to start with. We tell them how to be best in their life.
Right.
So I think this holistic approach in the early school, first 2 years, prepare them well.
Right.
And then when they go to the clinical years, I think that's more fun there because you start directly dealing with patients in the hospitals.
Or to expose them early on about what they have to go through later in the clinical phase.
So yeah, the tough part I feel is the first 2 years because they're just studying the books.
Right.
So I think in the clinical years, they have many things to do bedside, more in the hospital, more applying the knowledge, understanding how to manage the patients. I think one of the interesting part we do give to our students in Taylor's University School of Medicine, we do shadow housemanship in the final year.
Shadow
Housemanship. Before they become housemen,
Yeah.
they will be attached to a short time, a few weeks with a doctor and see how they are prepared. Are they competent to become a doctor and house surgeon also? So that's a unique thing we are providing to our students that once again build the confidence.
Right. It's like a training before they go into the working world.
Real
Okay.
world.
Alright, so I mean in terms of medical school, I mean a lot of people say that it's difficult.
True.
You know? So is it true, and what would you say are some of the things students are least prepared for when they enter medical school?
As I mentioned, yes, I too heard a lot of people, oh, you become a doctor, you should have, struggled a lot. I don't remember. The best time I think I had was during exam time when I study whole nights. And because studying whole night looks difficult, but I was clearly motivated that, yes, I want to become a doctor. And when you start studying and seeing the patient, the biggest challenge I feel if you don't have a knowledge.
Right.
And you start getting the knowledge, you start feeling happy. This is what I want to satisfy. So I think first important thing, you should have a motivation and passion also. Then you are very clear what you are with. I think as I mentioned many things before, with how this field will be when you come in the realistic, and I think it's not that way. It's a relative term. Once again, I just want to add. So the hard thing the student tell for the students when they come, yes, be prepared. I think one more thing I can add very interestingly, I always encourage the student, when you want to take medicine as a course, please do some observership in hospitals.
Right.
Be attached to a doctor. Many private hospitals do that. And be with them for a week, or if not, just go to some clinic and see how doctors are doing, what their work is, how the life is, what the challenges they see. Because from outside it looks difficult, but when they
Want to actually,
so then you can decide, is this really what I want to do?
Yeah.
Is this what my passion for? I think that will help them.
Right, so it's best to prepare yourself, it's best to observe and explore first the field before actually jumping into it.
True.
Alright,
That's because today's world is very competitive and there is no back looking once you go ahead.
Yeah.
So I think that's one thing they can do for.
Okay, alright, okay. So moving on to housemanship.
Yeah.
Can you share with us a bit more about what goes on during housemanship? What is your day-to-day activities?
Yeah, housemanship is an important part of the medical course to become an MBBS doctor. Definitely, anywhere in the world also, they will ask you, have you done the housemanship? In fact, you are not a competent doctor to practice until you do housemanship. Though when you finish 5-year MBBS course, you are awarded as the degree of Bachelor's of Medicine, Bachelor's of Surgery, but you are still not licensed to practice.
Right.
To get licensed to practice, you have to fulfill the housemanship. 2 years here in Malaysia. Basically, in housemanship, you are shadowed or you are attached, supervised by a specialist or doctors for different subjects. There are 6 basics is compulsory, 6 subjects of medicine, surgery, obstetrics and gynec, then there is orthopedics and there is pediatrics, and then there are some minors you can select by your choice. If this is one more place you can expose to different specialization, but minors are like psychiatry, emergency medicine. There are either you can go for radiology also. So this is what they go through, and public health is a very important component. So during the housemanship they go through all this in a rotation fashion. At the same time, they are very much accountable in the sense they need to maintain a logbook, they need to see the particular cases, they need to manage under the supervision before they certified competent. It's something licensed to practice we talk about. And basically, if you ask why this is so stringent, yes, this profession is dealing with humans, and you need to be, you cannot tell, without preparation you entering that place. So I think everywhere in the world it is agreed we need this. That's why the duration also, people can think the world is developing so fast, things are sophisticated, can we compress this course? No, knowledge is becoming more, diseases are coming new, you need many things to know. So I think housemanship is once again, it's an interesting and jolly period. You are a doctor, and you're not that much stress of some assessment. They do assessment, but it's not like typical exams, writing down and things. So I think that's the best time also. You get salary also, you get paid
for like studying and learning. Alright, okay. So there are many reports about the long waits for housemanships, and many students are understandably concerned at having to wait for months before they get, posting at a hospital. What are your thoughts about this?
Yes, I do agree. In Malaysia at this point, there's a waiting period of at least 8 to 10 months. And that is an issue because not related to either we have more doctors or something, but it's more with administrative. We have limited hospitals, placements available. And at the same time, we need more doctors in the society. There is one more myth in the society, is in the Malaysian society, is that we have more doctors. No, as per to the requirement standard, we need one doctor for every 400 population. At present, we are just one doctor for 650 something. In fact, in Malaysia is 1:1,000. So we need more doctors. In fact, we need more specialists. At present, you may see the general doctors, but we need more specialists. So internship, government is working on that. Definitely, they are trying to do more setups where students can do. But because the Malaysia vision to be one of the developed countries, and at the same time health sector is important, and we need doctors in the society
Yeah.
so that they can become specialists. We cannot wait till we set up everything and start doing. The student should understand that, but there are many options the student can have it. At the same time, for example, in our university, Taylor's University, people who are waiting, they can do some research activity as a research assistant. It's a paid job.
Right.
There are many things the students are doing. I don't see students are getting frustrated as such, which when I talk to them, yes, there is a waiting, but the government is working on that. As soon as possible, the new hospitals comes up, or they are looking into private hospitals also to get into it. So this should be solved as soon
Okay.
as possible.
So you can see that students, while waiting for the hospital, could be doing some other related fields like research or
Yeah.
contributing at least
True,
something.
they have options for doing short degrees also. There is, for example, I did a degree in medical education. There are universities which are providing 1 year medical education degree, so that they become masters before they're going to
Yeah.
internship. So,
Yeah.
so there are many options they can go for.
Okay.
Yeah, and added to their advantage.
Yeah, that's actually a really good tip for students who are actually waiting for the housemantships. Okay, so once someone has completed their housemantships, what's next? Can one immediately start pursuing a specialization, or do they need to work for a few years first?
Yes, as I mentioned, at present in Malaysia, the government expect them to work as a MO for 2 to 3 years, depending upon the contract and availability of post-graduation. I think that's is need for the profession. As I mentioned, the post-graduation or specialization in medicine, it's not just a course
Right.
like any other. You do 3 years, write an exam, you are qualified. It's more an experience
Right.
in that profession to be you call as a competent surgeon or a competent physician of that specialty. So they have to show the interest first, develop it, and enter that, and then go for specializations. There are countries they can go immediately also. There are some exam patterns.
Oh, so there are some exams before you have to go
Yeah.
into. Okay.
Like in India, we call the postgraduate entrance examinations. So they have a different system. They have whole country students write a single exam. Based on that, the allotment of the specialization.
Right.
But disadvantage also with that, the student may not get what they want. So I think in Malaysia we have a fair policy of show your interest, then you come up with this.
Right. Okay. So how does one go about choosing a specialization? Sorry, are there any specific requirements?
As such, no. The most important is you should have a basic qualified degree, you have completed internships,
Okay.
and then you should have registered with medical councils like Malaysian Medical Council, and more important is you have to show the interest that you are passionate to do this profession.
Okay.
And I think that will make them more competent and good doctor in that specialization. So that's how they go for that.
Right. So, for instance, if I did my housemantships and then I wanted to pursue pathology, so I can just where do I go from there?
I think after internship, the Malaysian government do offer every student a placement as an MO,
Okay.
depending upon the availability, and they give the contract. And that time you have an opportunity to choose where you want to work with.
Okay.
And if you have worked with pathology and you are in the same department, then you can work on the same line. Okay, I want to be specialist either in pathology or in pathology. There are many disciplines. For example, you can become a forensic science specialist, or you can become a hematologist. You can become a histopathologist. There are disciplines, open microbiologist. So I think that's how it works in Malaysia. Different countries have different system, but Malaysia go this way.
Right. So you just expose yourself into that and just try to build on from that onwards.
yeah.
Oh, okay. So, are there any particular medical specializations that are in demand right now?
I think overall in Malaysia we need specialists. If I think you may agree, you just go for looking for specialists, may not have many options. In fact, I was looking for a number of pathologists in whole Malaysia. What are the data I saw? If it's not wrong, it's a 140 specialists.
Okay.
So maybe plus or minus people who are practicing and other things, but it's very less number compared to the developed countries and other countries. If you ask about like in India, a city like Kuala Lumpur may have more than 500
Right.
So we need a lot of specialists, definitely. Every specialist has this own value in Malaysia. I tell you, there is still we have to go way long go. At present, we are just covering our basic doctors yet. We have to work a lot. Definitely, the ongoing things are many. They are specialized, especially in, I think, on demand. We can talk about psychiatry. We can talk about radiology. We can talk about, skin specialist. There are many things coming up.
Right. Okay, so you would say that basically right now, like a lot of specializations in demand.
True.
So students who are interested in anything can just pursue
Go
this,
ahead.
explore.
Yeah.
All right. Okay.
That's just to add, Malaysian healthcare is still long way to develop. So there is a lot of potentials in this field. There is I see a lot of. I'm staying in Malaysia for last 10 years, and I have seen the things in India. I can compare and tell how much it still need have a potential.
Right.
The health sector is a big potential in Malaysia to develop in future.
Okay. All right. So, what are some career options for medical graduates who do not want to be doctors, or is a medical degree strictly for those with intentions to be a medical officer?
Yeah, this question, it's not that way that if you are here that you are going to only become the doctor, but yes, majority of them want to go to for clinical practice. There are many options, definitely. For example, within the medicine, either you can go to clinical practice or you can join the teaching like I'm doing. I'm a full-time teacher now. I did my practice before, but for last few years after my medical education degree, I'm more in developing medicine curriculum, teaching methods, and or you can go for research. I remember I have a very good friend who is in US who is both got certified MD medicine doctor, but he's a clinical research director.
Right.
So it's the way you want to go for everywhere you have option. This is within, or some doctors we choose to be combination, teaching plus research, what I'm doing now, or some can do teaching and also practice or teach. So combination they can go for depending upon the need, time they can dedicate, and I think there are now new areas has come up. There's a lot of things our medical doctors are needed also. In fact, in Taylor's University, we are encouraging, I just at the start I mentioned we have our students can do elective postings in the clinical years. It is for 8 weeks, in which the 2 weeks they can do it in a non-medical field.
Okay.
For example, we encourage, that's a unique thing you can get in Taylor's is because we have School of Finance, we have School of Business, we have School of Law. Our students go and work with them. Means they do an observation. For example, our students can have a lot of option now in medicine. They can become, a forensic science expert. They can become in a law firm a medical expert. They can go for, and not only that, they can become in administrative roles, hospital managements and all those things, or they can be in pharmaceutical industries, either in the leading the research or the business, marketing. I think there are many ways they can do, including in case of finance. For example, insurance. Nowadays, everybody is insured. Who is looking that this is eligible or not and giving a guarantee? They are the doctors who are sitting behind the screen also. So there is a lot of scope in the today's world. And in Taylor's University, we do give them all those exposure to different disciplines they can choose. I have student who was done MBA in administration with a medical background. So there's a lot of things they can do.
Right. So with a medical degree, students can just find a path that they can just expose themselves into and then just. Alright. Okay. Yeah. Just dive into it.
True. There are many ways they can go for.
Alright. Okay. So as we are nearing to the end of the session, so let's take a look at some of the questions we have from the audience.
Okay.
Okay. So let's see. Okay, so we have one from Anas. Is the path toward veterinary the same as doctor's path, husbandship and all?
No, it will be different. It's a totally different profession, though it's related to bioscience and anatomy, physiology, the same subjects you go through. But the requirement is different, the registration system is different, field is different.
Right, of course.
So it's not the same. Yeah.
Okay. How do students practice their surgery skills on real human body?
This is a very interesting question,
Yeah.
yes, and I'm really proud now being there's so much development in different science, especially the material science and 3D science and simulation. Yes, we do practice our student before they go. For example, very simple, putting an IV cannula, we call vena pancha,
Okay.
everybody has that fear, and many people may have that fear, oh, young doctor is doing, whether he'll do perfect or not. But from the year one or early years in our medical school, we teach them on a mannequins. Mannequins which are almost like a human feel, the real sense, and they practice. So before they go to the patients, in the early years of the teaching, we expose them to simulation-based medicine. We do have a full simulation lab in Taylor's Lakeside campus, and also another simulation lab in the hospital on our clinical campus. So both places, the students are made to practice before they do it on real. And at the same time, during the postings, they are posted inside the OTs also. So they will be standing with doctors to see how the surgeries are going on. And during internship, they are assisting that. So it is not directly given, but over the time, and simulation making a big play there.
Right. So after the students have mastered this mission, then they will be in charge of performing it on real bodies and shadowing their supervisors. Alright.
So it goes phase wise.
Okay. So last question, Dr. Imam, to end this note, what advice would you give to those who want to pursue medicine?
Yeah, I can tell you have seen my talk, and it's a passionate field. It's a lot of things you can do, and there is a lot of demand. Many people may think there are many doctors. I tell you, this is one profession you can do many things. Many times the student asks me, the world is very materialistic nowadays, everybody want to be in the good part of the life, and you want good house, car, and doctors are getting everything. But the most important, you ask me, what's the best thing you like in this profession, is part of the care to someone. And that, because of you, somebody is getting relieved of their suffering and pain. I tell you, that feel is making you entertain like anything, and make you happy like anything. That cannot be compared with money, name, passion, or whatever you think of. In fact, many people may ask, oh, this profession, you have to work 36 hours. How can you do that? I remember I have done 36 hours posting in the hospital, not coming out, but that was a fun for me. I never felt I should go out now, because the things goes on in the hospital, so your adrenaline is rushing like every day. And you can imagine, adrenaline rush make you so happy. People do so many things to do that, but we are every day in that. And most important, telling you are in the care field. People are suffering, people are in pain, and you being the empathetic part, playing a major role in making them out of the suffering. And that is one thing you will never miss in this medicine. Apart from that, you have everything what you want a professional to be, a good life, a good society. You can do many social activities. You can help many ways to the society and be in a happy life. So this profession is still, I don't see any doctors sitting quiet, any doctors doing no jobs. No, everybody is doing their best. So look forward. If anybody is interested, do some observerships with the doctors. Go and check how the field is, and look whether it's really for you. If you feel yes, go ahead. Don't think. And one more thing in this profession, which I just want to add, the last point. This profession needs hard working. It's if you are not scoring very extraordinary in the schools, it's not a matter. If you are a hardworking student, go ahead with the medicine. If you need just dedication, because there's a lot of knowledge to acquire. There's not much to innovate. Means what you call intelligence to apply something, mathematics or something. Acquire the knowledge and apply. That's what the medicine needs. And I think hardworking students will always succeed in this.
Of course. So it's a very rewarding field, that is.
Exactly.
You get to apply what you've learned for like 5-10 years into your working. That's actually really good. Thank you for that, Doctor. So thank you for joining our conversation with Dr. Imam Sheikh about the pathways to becoming a doctor. We hope you have gained a lot of insights on your interest in pursuing the medical school as well as college planning. Do come back for more of our webinars and have a good day ahead. Thank you.
Thank you very much.